Hi, everyone, and thank you for joining us in today's seminar. It was with great honor that we welcome Dr. Natalie Schwaka to share her work with us today. And she is an assistant professor of environmental and occupational health at Colorado School of Public Health and a faculty member of the Centers for Health, Work, and Environment. She received her PhD and master's degree in occupational safety and ergonomics from Colorado State University and her bachelor's in psychology from the University of Portland. Dr. Schwaka has strong ties to us in Portland, Oregon area, having interned at OHSU with us during her undergraduate studies and have collected her PhD dissertation data with Oregon contractors. She has dedicated over a decade to advancing the total worker health approach and focusing on business strategies, leadership practices, and organizational culture to enhance workers' safety, health, and well-being. She has significant experience in designing and evaluating leadership-based studies and interventions in multiple industries. So finally, she directs the NIOSH Mountain and Plains Education and Research Center. It's called MAP, ERC certificate in total worker health programs. So without further ado, let's welcome Dr. Schwaka to lead us through her presentation. Thank you, Natalie.
Wonderful. Thank you, Emily. I'm so excited to be here. Like Emily said, I spent 3.5 years in Portland at UP up on the bluff. My husband is from Vancouver, Washington, so we go back there a lot. And I collected all of my dissertation data with a few Oregon contractors. And so even during my doctoral studies, I spent a lot of time in Oregon. So I love Oregon. And like she said, I interned back in, what was it, 2008 at OHSU. I've been to your campus a lot, so happy to be here virtually.
Thank you.
So my talk today is on leadership for workforce health, safety, and well-being. My plan is to go over sort of my journey in this research, all the various studies that I've looked at this topic from, instead of focusing on one study, so that you can see sort of the progression in my life and where I'm going with leadership research in this space. I know that folks at OHSU and Portland State do similar work, and so I'm excited to hear your questions and hear your perspective, because I know I have a lot to learn from you all as well. So I am with the Centers for Health, Work, and Environment at the Colorado School of Public Health. We have an ERC, so we have 6 or 7 now training programs in occupational health, and one of them is Total Worker Health that I direct. And we're also one of the Total Worker Health Centers of Excellence, like you all. I would love to acknowledge all of the folks who contributed to the work that I'm talking about today up front. It's a big team effort to do the research that we do. And so I just want to highlight all the folks at our center, all the folks at our School of Medicine, our School of Business, and folks out on the East Coast who have contributed to this work as well. And just acknowledge that the work has been funded by NIOSH and AHRQ. So we know, I think we all in this room know that leadership is important for workforce health, safety, and well-being. And we know that leadership is related to a lot of important safety health outcomes. I put a few here up on the screen: safety climate, safety practices, injury, but also the health and well-being of workers. And we know that there's some indication, at least, that if we can train people, leaders and organizations, to improve the way they interact around this topic, we may see improved outcomes. And so I think there's evidence and in your general sense in the literature, but also in the business community, that we need to figure out ways to enhance leadership in organizations so that not only is there a sense of value for workers, health and well-being at a leadership level, but there's that baseline support for folks who are trying to implement changes that are related to workforce health, safety, and well-being. Excuse me, I have a cough. So my main questions that I have been thinking about lately, and that I'll come back to in a little bit, is how can we make leadership development for health and safety and well-being more effective? There are several intervention studies out there on this topic, and I think generally show some good, promising outcomes. But I think, as you'll see, when the rubber meets the road, when we're talking about leaders actually implementing these skills on the job and making changes, it becomes really hard to do that. And so how can we make these development programs more effective? And also, how can we better support people who want to be leaders? Help them identify as leaders in these cases and help them want to engage in this kind of development. So something that I have also been interested over time is the similarities and differences that we may observe across industries. And so in my career, I've had the opportunity to do a lot of this research in construction. My PhD was on leadership, safety leadership in construction with Oregon contractors. And that thread has sort of continued throughout my career in the decades since. But I've also explored this in the small business context across a variety of industries, and more recently in the education and healthcare sectors. And so what I would like to do is sort of tell you the story of what I have done on this topic from my perspective after engaging in a few research projects, and in an effort to help explain what made me switch gears a little bit and where I'm going next. And so the first, and just to put it into context, I graduated from CSU in 2014. And so all of this work sort of explains where I've been since graduating in 2014 from CSU. So the first thing that I did after graduating was the Foundations for Safety Leadership Intervention study. This study was funded by NIOSH through CPWR, the Center for Construction Research and Training. The study was, in my opinion, one of the coolest studies because not only were we focused on, developing an intervention around this topic, but also actively working on translating it into practice and getting the training out there for folks to take. And so when I graduated in 2014, I spent about half my time working on the safety leadership project. And it was at a time when the industry, I think, was super hungry for a way to improve their safety culture. And many already understood the value of leadership-based approaches. We took an evidence-based approach to developing this leadership program. We focused on the transformational style of leadership, which is a pretty popular style of leadership that's studied in our space of health and safety. And we just packaged it and formatted it into a training that was relevant to the industry and that was relevant to adult learners. And we were able to test it in 3 states, in Boston, West Virginia, and in Colorado. And we found that the foreman, we were focused on sort of the supervisory level. So the foreman in the study learned some new safety leadership skills. They improved upon their safety leadership practices, self-reported. But interestingly, we didn't see any changes in career-reported indicators that leadership training made a difference. And anecdotally, during the trainings, I heard a lot of the time that, a foreman would say this content is great. I would love to apply this with my crews, but hey, my superintendent would never, does not care about this, wouldn't give me the time and space to do this. And so I think this training represented a tool that contractors could use to start the conversation about the importance of safety leadership, but it wasn't necessarily the golden ticket. And so I'll come back to what this training entails a little bit later because it's relevant for a current project. But so then the next thing that I did, so the FSL was focused on the supervisory level folks, the foremen. In the next few years, actually at a similar time frame, I started focusing on senior leaders. Just because I started to feel like supervisors, great, we need them on board. We need them displaying important safety leadership skills. But if their top management was not on board, any effort to train them and get them up to speed would sort of be useless. And so the team and I in Colorado developed a small, safe well intervention study, and it was focused on small business. And it was a large-scale randomized intervention study where we were really focused on the senior leadership folks. How can we get them to change their own leadership practices so that they're supporting the people who are boots on the ground, developing health and safety programs, supporting the supervisors who are running with it on a day-to-day basis. So we decided to target owners or other key decision makers, and we expanded upon the time in this intervention. So in the FSL, we were only with foremen for about 2.5 hours. That's all that the industry would give us. But for this study, we decided that we needed more time if we really wanted to change the business leader and hopefully facilitate some organizational change. And so we created a 6-hour senior leadership training program that also included 3 months of training transfer support. And so senior leaders would come to this training. They would learn about important leadership skills. They would get some data on, what does total worker health look like in their organization right now. They would collaborate with another business, like an HR or safety manager, during the training, come up with some goals. And then after that, they would spend some time coaching with me to talk about their goals, talk about challenges, and to really practice and apply what they had learned in the training. But unfortunately, while we saw some good indication that these small business owners reported improvements in leadership practices, we saw that we actually increased the stress that they felt on their job. And I think this is something that Leslie has also found in her research. So this idea that we're adding something to their plate, they may be passionate and they may care about this, but telling them to be health and safety leaders, increase their work-related stress. And we also didn't observe changes in worker-reported indicators that leadership training made a difference. And again, the thing that we came back to was this training transfer piece. So through some qualitative work, I learned a lot about these leaders having some really wonderful intentions and wanting to change, but just not having time, or not having the team or the support to actually make the changes that they wanted to make. The bright spot in the study was that leaders collaborated with others during the leadership training. And it was sort of an afterthought in the training for us because we didn't originally intend for multiple people to come from the business to the training. But during the pilot training, one of the contractors that participated wanted to bring their HR director. And it ended up being a bright spot because it taught us a little bit of something about shared leadership, which we'll get back to in a minute. We also learned a lot about how businesses are all different. All these businesses, these leaders are at different starting points. There's some who are really great. They're focused on, very comprehensive strategies around total worker health. But a lot aren't. A lot are at the starting line. They're just starting to think about what does health and safety and well-being mean for my organization. Sometimes you'll find organizations that are more focused on safety. Maybe it's a high hazard industry. And some that are focused more on health and wellness. And so we learned a lot about meeting businesses where they're at and helping them with their specific needs. We also learned a lot about the value of data and giving business leaders data about what is going on in their business. They really valued the opportunity to see assessment results of what they have programmatically and what their employees say about the culture in their organization. And they could then use that data to make goals about what they wanted to change. The other bright spot was learning about the fact that leaders need community. During our leadership training, business leaders from multiple companies and a variety of different industries were able to come together, learn about safety and health leadership concepts together, share stories, share what's worked. And that community piece, I think, was a real bright spot and lesson learned about training people as groups and community, not as individuals. And so between the FSL and the SWELL study, I really started to feel like organizations cannot hope to achieve their total worker health goals if only one person is a leader, or even if they're training multiple people to be leaders in an individualistic way. Everyone needs to be working together. Top management up here needs to be setting the stage to carry out that vision, to set that vision, to provide resources, hold people accountable, etc. Supervisors down here need to carry out that vision consistently with their teams, and employees need to engage in health and safety programs and support their peers. And then often left to themselves are the health and safety leads, who also are leaders in their own way. And I think this concept isn't necessarily new, right? In our field, we're always talking about management commitment, and we need to get that. It's really important. Employee engagement is also important. But what does that actually mean, and how do we get there? So this, a few years ago, got me really interested in the concept of shared leadership. And not a lot, at the time, not a lot had been done on the concept of shared leadership in the context of total worker health. Most of the research in our space had focused on vertical leadership, and more specifically, that transformational leadership style and how it's related to important health and safety outcomes. Unlike that more traditional focus on vertical leadership, shared leadership focuses on the influence shared across team members, where anyone can be a leader, and the actions of the collective are more important. And in theory, anyone or groups of people who are sharing leadership could use any style of leadership. And so in the literature, when the papers talk a lot about when could shared leadership be useful, and it may not be useful in all instances. And they say shared leadership could be useful in the context of really complex problems that people have to solve, or when there's interdependence of job functions and policies and programs, when you have to find creative solutions, and also in the middle of developing or executing projects. So there's some indication that maybe during the timing matters for the shared leadership approach. Shared leadership could be a promising approach for total worker health. That has been my hypothesis for a few years now. Total worker health, as you all know, it's a very common, up and coming approach to workforce health, but it's definitely complex, and it's hard for teams or individuals to do it alone. And the upside, I think, for formal leaders in this situation is that they can seek shared expertise, and they can share the load with others willing to influence change, which I think is important given what we know, at least what I found in my research. And it leverages the resources of others and social support to shoulder the burden. And so it could potentially be useful. So a few years ago, I got a career development award from NIOSH to explore this concept with small businesses. But then COVID happened, and I had to shift my plan a little bit because data collection became challenging, as many of you probably experienced. So I originally planned to study this using qualitative approaches since it felt so new to our space. But the recruitment for this was a little bit challenging, so I pivoted. And I initially went back to my roots in construction and did a survey with local contractors. I also built up some relationships with the School of Medicine here and had an opportunity to do some qualitative work with hospitalists. And then finally, along the way, I received a grant to study mental health emergency preparedness with public schools, and ended up embedding some shared leadership concepts in that project. So the first study I did was in the construction industry. It was just a cross-sectional survey that asked about various factors that I thought would be related to whether crews would report sharing leadership for total worker health. So in looking at the literature around shared leadership, about what may foster a shared leadership approach in teams, this is the list that I came up with and tested in construction. And I thought about it from various target levels. So for example, at the organizational level, you would think that if there's a strong safety climate, health climate, people were trained in health and safety, they may be more likely to report that their team shares leadership for total worker health. Same with team level factors. Do your coworkers support you? Do you have team psychological safety? Do you have a shared purpose? And also from your supervisor, if they support you, if they generally display effective leadership skills. And then also I think for people individually, like, do they feel like they can speak up around issues? And do they see themselves as a leader for total worker health? So I did a survey with some contractors, and ultimately what I found was that the factors associated with sharing of leadership responsibilities were depended by whether the crew member was in a leadership role. So employees, so people not in a leadership role, those crew members reported sharing leadership if they had enough training and if they had an identity as a total worker health leader. The leaders, on the other hand, reported sharing leadership if they felt like their team had a shared purpose for total worker health and they had a personal voice around total worker health issues. But for everyone, coworker support was super important for sharing leadership responsibilities. And the thing that really interested me and that I didn't quite expect was this identity piece. Leaders identified as health and safety leaders more so than crew members, which sort of makes sense. They're already in a formal leadership role. But this interested me a little bit. And so I had one of my research assistants do some follow-up interviews with the crews. And I got some interesting quotes that kind of help explore this identity piece a little bit more. So a female construction crew member felt like she was a leader for health and safety. And when asked, why are you a leader? Why do you think you're a leader? She said, well, I have the knowledge. I'm not afraid to listen and speak up. I guide others. I try to increase awareness and understanding. People come to them when they have questions. But she said being a female makes this challenging. But interesting, when we asked her who carries out typical health and safety activities with crews, she all listed people who were in a formal leadership role. There's another example of a male construction crew member who did not think they were a leader for safety and health. And he said, I just see myself as a participant. I don't feel like I know everything about workplace health and safety. A leader should know more about certain things. I don't see myself teaching other people. I just know it keeps me healthy and safe, and I'm not comfortable with it yet. So this identity piece interested me. And so when I moved on to the healthcare study, I had developed some relationships with the School of Medicine and a group of hospitalists. And so I did some focus groups with them, using similar questions as I did in the construction study, but translated it for a qualitative study. And we found a lot of interesting things, which I won't go through. But for this presentation, what again came up for this population was identity. Frontline hospitalists, so those not in a formal leadership role, many were very much against being leaders for health and safety and well-being. They did not see themselves as leaders. And I think this quote sums it up well, for them at least, in healthcare. I think maybe like one of the biggest barriers is just the work burden that's put on us. Do we even have the time? And at around the same time, when I started that mental health integrated emergency preparedness project with educators, the focus of the project wasn't directly on shared leadership. We framed our training around shared leadership because we wanted to place educators in a role where they were seen as leaders for emergencies in their school. And as part of our evaluation of that training, I was able to include some shared leadership measures in our surveys and in some open-ended feedback in our surveys. And in those baseline assessments, we were seeing that there was varying degrees of educator engagement in emergency preparedness, which you might expect, obviously. But again, this identity piece came up again. And the survey data, we found that, folks were willing to speak up and provide suggestions. But a lot, again, didn't want to be leaders or were hesitant to see themselves as leaders if they were in that sort of informal leadership role. So this elementary school teacher said, I don't want to be an emergency preparedness leader. I don't feel equipped. I don't feel like I can be responsible in an emergency. I could help my class, but that's all I want to be counted on for. So again, coming back to my questions, how can we make leadership development for health, safety, and well-being more effective so that it doesn't feel like it's one person's job, that they have support, that they can have that support? And how can we support people who may want to be leaders? And I think recognize that not everyone's going to want to be a leader. Some people may be a leader because, they've gotten into a supervisory role or management role, and so therefore they are responsible for their employees. But there may be some champions in organizations who don't have a formal leadership role, but who may be perfect for the job. You may just need some help. So after this work, with it in mind, I went in a couple different directions because I wanted to continue the momentum I had gained in construction. And I also wanted to continue this work in the healthcare space. And so in my remaining time with you guys, I would like to explain what I'm doing right now as of this fall to sort of tackle those questions around helping people or helping organizations train leaders more effectively and develop that leadership support. And the first way is through an R01, which I'll talk about first in the construction industry, and then a smaller R03 that I have in health centers. Okay, so and both of these projects just started in September, so they're very new. I don't have any data to share, but I will explain them at a high level. So my new construction industry project, the Collaborative Leadership for Safety and Health Construction Toolkit, funded by CPWR as part of their new 5-year National Construction Center Agreement, is a very exciting partnership between folks at my center, Lily Tenney and Olivia Zarella, and folks at CPH New in the Eastern United States, who are also a Total Worker Health Center of Excellence. It's a partnership between us, which I'll explain in a minute, because we are focused on empowering both leaders and workers in the industry to collaboratively address health and safety and well-being challenges within their company using a toolkit that we will create. Whoa, that was too fast. So the idea in this project is to provide contractors with a formula and give them the agency to determine what they want to change to improve their employees' health and safety and well-being. In our mind, it's a 3-step process where both management and workers work together to do a needs assessment, do some leadership and health and safety upskilling training, do a design sprint to develop a solution, and then implement the solution and evaluate how well it goes. And coming back to the FSL, it's grounded in both the FSL and New England's Healthy Workplace Participatory Program. Because one, we want to have an element of leadership development in the toolkit, first and foremost. Top management and all leaders need to be on board with the value of supporting their workers' safety and health. And also a select group of workers need to be trained on this as well so that they can be effective leaders. And so the FSL is a 2.5-hour interactive training. Like I explained before, it focuses on these 5 critical leadership skills, very similar to the transformational style of leadership. And the training emphasizes case-based learning. And our task for this project will be to translate this into a way that includes health and well-being. So right now it focuses more on acute injury prevention, and we will be also including concepts around mental health and well-being, specific to construction. And for some context, it's, the FSL has been used by almost 1 million participants so far. It's a very well-known training in the industry. It's been adapted for different kinds of audiences, and people love the training. And our task, again, is not to, redo what was happening, but just to add to it so that it includes more of a total worker health flavor that focuses on leadership skills for health, safety, and well-being. And the other cool thing about this project is including CPH News Healthy Worker Participatory Program so that we can encourage the leadership of folks in worker roles, so the crews. It's a cool program because it has considerations for a committee of management who is trained and on board and helping make decisions and allocating resources, and a design team of crew members who are given upskilling training to understand health and safety. They're given the latitude to design solutions and to work with management to improve the workplace. And the HWPP has been used and translated in a lot of different industries, but not yet in construction. So right now we're figuring out how to actually accomplish this in construction. And in our 3-step process, the idea is in the planning stage, contractors will receive leadership training so that FSL gets modified to include total worker health concepts. And also some forming of committees and teams and training to encourage both management and workers to work together collaboratively to design solutions that are relevant to their workforce needs. Once that happens, the crews, so those who aren't actually in a formal leadership role, will participate in a design sprint to identify some solutions to a specific total worker health challenge. And then management will review those solutions, pick in collaboration, pick ones that will work and allocate resources. And then they'll work together to create an implementation plan, carry it out, and evaluate it. In the context of shared leadership, I've built in some metrics to understand how the management and the worker committees and design teams are working together and sharing leadership for these organizational changes. So as you'll see in a second, I'll be collecting some longitudinal data on whether the toolkit that we have, that 3-step process, increases the effectiveness and leadership capacity of these task force, and what organizational and personal factors might help explain changes in their effectiveness and leadership. This is the sort of roadmap for what contractors will do in this study. And the little stars just display when we'll be collecting those task force effectiveness surveys, trying to see, how their perceptions of, actually I have a slide for that, how these various factors change over time at the various time points during the implementation of the toolkit, not just before and after the toolkit. And very much interested in things like collaboration, voice engagement, leadership, their own personal leadership and whether or not they're sharing leadership, and those barriers and facilitators to sharing leadership. So I'm very excited to do this larger study in construction to sort of look at the longitudinal aspect of, for example, when is sharing leadership most effective in the process of this project. And the second project that I have going is in healthcare. When I started working in the healthcare space a few years ago, thinking about this topic of shared leadership, I did a literature review of healthcare leadership programs and wrote this editorial. And I think what was interesting, at least in healthcare, there's a lot of different leadership development programs for the healthcare space. But I think there's some sense that it doesn't help prepare them to tackle those organizational level challenges, the complicated health systems that need to change in order to improve healthcare worker health and safety and well-being. There's a lot of different kinds of modalities to these leadership development programs, but quite often they're not considering the context in which leaders are implementing their leadership skills, which affects the effectiveness of these programs. And so I wrote an editorial last year trying to think about what could enable leaders in healthcare to transfer leadership skills to the job. And I came up with this multi-level framework for understanding what may facilitate or inhibit healthcare leadership. Drawing upon frameworks that aren't new, but have been applied in lots of different contexts, notably the job demands and resources model. Just thinking that, leaders go into these leadership trainings, they learn a lot of great things, but then they go back to their units and either they don't have enough staff, they have poor workflows, maybe they have too much work going on, and they don't have enough resources like time or social support to enact those leadership behaviors. And on the personal level, maybe, we don't know what's going on with their coping strategies, their resilience. So these sorts of things can limit how effective leadership development can be, and ultimately, the outcomes that we're looking for. But even thinking up a level, what within the healthcare industry or within a healthcare organization could inhibit the effectiveness of leadership development. Communication strategies, the culture of the healthcare organizations, the conditions of work, but also thinking about like government regulations and technology changes. And so I think just trying to push us a little bit to think about moving beyond just leadership training to thinking about, okay, what's going on before and after this leadership training happens. And I started thinking about this in community health centers, federally qualified health centers to be specific. The FETSR did a qualitative study in FQHCs, and they found that healthy work environments guided by transformational leaders promote retention. So there's this sense that, again, this good leadership makes people want to stay at their jobs. That makes sense. But health centers, I don't know if any of you have worked within them, a lot of them are small. They have a lot of resource constraints, and they really struggle to deliver high quality care with these resource constraints. There's movements to want to change the system, not the worker. And there's really some uncertainty about how leaders can change working conditions in these settings. So I got a small grant in our 03 from AHRQ this fall to study organizational strategies to support community health center workforce well-being. And the goal is to understand their work environments and well-being needs from various perspectives. So management level, health and safety leads and workers, figure out what's linked to retention and determine how leadership can advance workforce well-being and retention. I'm the PI on the project doing most of the work, but I have a lot of great advisors from the School of Medicine and the Colorado Community Health Network who are graciously allowing their time to help me learn about healthcare and community health centers. And the aims of this study are, I'm doing an organizational assessment around their policies and programs, doing some interviews with staff and leadership, and doing a worker survey. But in the context of leadership, ultimately in health centers, my aim is to develop a sort of intervention study a leadership-based intervention study in these health centers to try to change their organizational practices. And so I'll be spending some time with senior leaders in health centers, as well as mid-level managers in various service lines, like dental and primary care, et cetera, and understand how they are or are not leading for health, safety, and well-being, what supports they need, for example, what leadership development strategies they have in place right now, if any. And so that's just a 2-year project, so not an intervention. We're at developmental stages at this point. So coming back to my main questions, how can we make leadership development for health and safety and well-being more effective? I'd be curious about your thoughts. And how can we support individuals who wish to be leaders, knowing I think that not a lot of folks want to be leaders, but if we do, how can we give them the space and the time and support to step into those roles, because we know that we need them. And I'll just end on this slide. Use the QR code. If you aren't planning on going or haven't heard about it, please consider looking up our Total Worker Health conference that's coming up next October, I think, November. But the deadline to submit proposals is December 20th. So just a small plug there. I think that's all I have. Happy to answer any questions.
Great. Yeah, thank you, Natalie, for such a great presentation and project. Yes. And do you like to stop sharing the screen so we get to see people, or yes? Oh,
Yes.
Yeah. Thanks again for such a lot of great information. So maybe let me start it with, again, I'm so very, very happy, very grateful, and appreciate to see you applying the system approach for your leadership training, right? Involve not more than just employees, supervisor, all the way to top management team. And I know how difficult it is to work with top managers. And one little tips I learned with Professor Zoha when I work with him, join him, would be the top managers. We always try to invite top managers more than just safety department. Like in the feedback workshop, we'll purposely saying, would you like to invite the HR department, the operation departments, and also the president, the vice presidents, the whole executive team. So the training and the feedback workshop, the education section, again, we like to involve more than just safety department. We're purposely saying, please, we like to see HR, especially the operation department, the competing demand between safety and operation, right? So it is important to involve. So I do have two quick questions. Yeah, I like to check with you. The first would be about the time. I see you include like 2.5 hours with supervisor, 6 hours with senior. That's quite amazing. You're able to get a lot of time. They keep saying they are so busy and they are able to spend those time with you. And that's great. I'm very glad to see that. And the other quick question would be, since you work with construction, I'm very curious to have you differentiate between the company organizational culture and climate versus the job site cultures and the job site with multiple companies. So that's the two quick questions I have. Yeah, thank you.
Well, I think the second was the company culture versus the job site culture, and that actually came up during our first advisory board meeting this week. I think our approach as step one is to focus on company culture, and then get into the approach of how do you deal with the culture of multiple organizations on one site where people are coming and going. So we're not going to approach that yet, but I think it's completely valid.
Right. Yeah.
And I'm sorry, what was your first question?
And the first question will be the time you request from supervisors and top, like 2.5 hours. That seems, I'm glad to see they are available, because most of the leaders say an hour and 35 minutes, 40 minutes is the maximum. Yeah, they're available.
Yeah, well, I'm glad to hear that. That sounds like a good number. We wanted more with the 2.5-hour construction leadership training, but they couldn't stomach more than that. But I think it presents a selection bias, right? Especially for the leadership, the small business leadership study, where it was like basically a day-long training. The folks who were willing to devote the time. But yeah, no, we were able to get enough to come, and they were interested, and they loved learning from us, but also others in their community who are really being challenged with the same problems. So
That's great. Yeah, I'm very glad to see that. It's good. Thank you. Any other questions? Again, it's really quite amazing. Very impressed with what you do. Yeah. David?
Thank you, Emily. And thank you, Natalie, for your presentation. Yes, very impressive and expansive your life's research. So that was great to hear. I'm intrigued about this concept of shared leadership. I think on paper makes a lot of sense, but I wonder about the power dynamics because at the end of the day, the boss is the boss. So yeah, I don't know if you can give us an example of how that plays out in real world settings.
I think that's a good question, and one that I don't necessarily have an answer to, but one that I'm trying to answer with this new construction study. I think that like Jen and Suzanne and Serena from CPH New, they've been doing this with their HWP Healthy Worker Participatory Program, where there is that joint management worker committee structure. I think it's gonna boil down to a little bit of investment on the outset to have some level setting conversations about roles and responsibilities and leadership support from the start. But I think that the quote from the construction worker, the woman construction worker who saw herself as a leader, I mean, I didn't get a chance to ask her about how that that interaction plays with her foreman, but she still felt like she was a leader. And I think people saw her as a leader. So I think it's more complicated. And that's why I wanted to start with some qualitative work to understand it more. So I wish I would have able to do that, but wasn't able to do much of it. I don't know if anyone else has run into that in their research or seen that in power dynamics.
I mean, all the time, don't we? And it really has to do with the people starting with the people who let you in, and then that is willing to share their opinion. But I think the qualitative piece is always useful, right? Because that will give you indications of the things that a survey wouldn't pick up.
I will say in this Well study, we did hear a lot from leaders who, when they were talking about their employees' engagement in health and safety and well-being, they was always talking about it as a barrier. Employees don't engage. Why do they never engage? They don't come to this training. They don't wear their PPE. So it's like, why? You know, they're not invested personally. You know, they don't have that motivation personally. So.
And also you mentioned a good point. When accidents happen or when things happen, it's always the employee's fault. It's been 40, 50 years of research. When there's a truck crash, it's always drivers' problems. When the nurses have back pain from moving patient, it's always the nurse's problem, not moving properly. So again, it's so important to involve the multi-level systems approach, different leadership. Why? What's wrong with those employees, right? There's an important role for supervisor, for top leaders, and really join and do the institutional change more than just individual change. Yeah. So that's, yeah, I've been learning that. Yeah. Thank you. Yeah, Erin, please. You are on mute. Yeah.
Oh, yep. Hi, Natalie. Super interesting and related to a lot of stuff that we're working on. One question I have is how what you're doing relates, or does it relate to employee retention? Because, you know, we're finding in the work on respectful workplace practices that a driver is employee retention, and that leaders are motivated around this agenda because they are aware that if they are not successful in changing the culture, you know, younger people, more diverse workers are not going to enter or stay in the construction industry. Healthcare also is experiencing major labor shortages. So two of the industries you're looking at have this as a kind of element or characteristic. So I'm just wondering how, if this comes up, or if this is something that you're exploring or hearing about or looking at in your research.
Yeah, definitely. I think if employees feel valued, that the employer respects them enough to, and values their opinion enough to want to involve them in designing the way work is done, I would want to work there. I would want to stay. I think, especially in healthcare, I can tell you the past couple of weeks as I've been recruiting health centers, retention is the main reason why they're saying yes to participate, because they want to know how to better support their workers, so they want to stay. Because unfortunately in Colorado, a lot of our health centers are bleeding out healthcare workers for a variety of reasons. And so I feel like if this shared leadership approach, it just shows a value for employees. It gives them skin in the game. It helps with professional development, professional fulfillment, meeting that connection piece. So yeah, I feel like in terms of like recruiting people into studies, yeah, for sure, it's helpful. And then I also think that the shared leadership approach has some promising outcomes in terms of retention. And also, I think a big problem that we're seeing at our center with our outreach programs, a lot of employers are saying one person is in charge of everything total worker health or safety. And when they leave, the program fails because they've lost all that institutional knowledge. And so if you have multiple people on board and leading things, that loss is less acute.
Thank you.
Good point. Yes.
And thank you, Erin, for being on our advisory board. I'm excited to learn more about how your work on respectful workplaces, we can apply that in our construction.
I'm excited too. So thank you. Thank you for inviting me.